Okay, guys, so this is going to be the Chapter 2 learning objectives that I'm going over today. So I'm just going to go ahead and hop right into it. So number 1, it says define natural immunity and acquired immunity. Natural immunity is going to be the kind of immunity that you get from your body. So something that's already there, born with it. So things like your skin, your mucous membranes, or tears, as compared to acquired immunity, which is something that you develop once you're exposed to it. And number 2, it says understand the physiology of antigens and antibodies. An antigen is the identification marker for a cell, whereas the antibody is going to be that Y-shaped protein that's produced by the body in response to the exposure. If you have a hard time remembering these, that I used to do to remember it was antibody ends in the Y. So you have your Y-shaped protein. So that's a little trick. You can help to remember those and differentiate them. Number 3, it says compare and contrast T and B lymphocytes. So for T lymphocytes, they're developed in the thymus, which thymus T lymphocytes, you can remember that, and they act locally on tissues. Whereas the B lymphocytes, they are developed in the bone marrow, and they act distant on tissues. So they travel a bit. And both of them are white blood cells, and they migrate to the lymph tissue and the bronchi. Number 4, it says listen, understand the 4 types of hypersensitivity. So type 1 hypersensitivity, you're going to have immediate or anaphylactic reaction. So the body is exposed to the antigen of the allergen. Type 2 results in antibody production. Type 3 is the immune complex reaction, where your antigens and antibodies combine to create that complex, which causes the inflammation response in tissue deconstruction. And type 4 is the delayed response or cell-mediated, where the T lymphocytes become sensitive to foreign antigens, which causes the response to happen. Number 5 is the pathologies. I'm going to skip over those and do them at the end since it's a huge chunk. So we'll come back to those because we're going to go over the etiology, signs and symptoms, prognosis, medical intervention, and PT intervention. But for those, I'm just going to point out point out big things that you should remember that go along with those. Okay, so number 6, it says discuss and explain the effects of exercise on the immune system. So moderate intensity exercise helps boost the immune system response. Intense exercise helps increase natural killer cells in the body. Also, it increases white blood cells in the body to help fight infections, and stimulates release of endorphins, which help as a natural pain relief. So, when you're out working and you're doing patient education and your patients are asking you why you're doing this or why you're doing that, that's some things you can let them know, that the exercising helps boost their immune system, which is going to help them fight off infections and anything that can happen while they're going through processes after surgeries or injuries. Number 7, nosocomial infection. This is something you're going to want to remember. It's going to come up over and over again throughout the next 2 years. It's an infection that the person or patient gets from a hospital setting. It doesn't have to be technically in a hospital. So if they go to any healthcare facility. So it's an infection that the patient gains while in a healthcare facility that they didn't come in with. So if you go in for surgery for a knee replacement and because of non-hygienic nurses, you end up getting the flu or something, that's going to be a nosocomial infection, or any kind of infection that they spread to you that you didn't have when you got there. Number 8, it says describe relationships between infections and universal precautions. That kind of goes along with it. So the universal precautions are there to help keep the spread of infections from patients to healthcare workers, and patients to patients, and healthcare workers to patients. So the infections are spread from person to person. So those universal precautions, washing your hands, donning and doffing as you're supposed to, those help decrease the risk of contamination of other people. Number 9, it says discuss and explain factors affecting antimicrobial resistant bacteria. So there's a few things that were listed in the PowerPoint. Overprescription of antibiotics. So if you're overprescribed antibiotics and you're taking them and taking them and taking them, eventually your immune system is going to become immune to them. So then next time you go to take them, they're not going to help you. Incorrect prescriptions or dosage, if you're not overdosing, but if you're taking too much of the prescription, the same thing. The prescription that's not specific to the bacteria. So if you're trying to fight off a specific bacteria, but you're not taking the right prescription for that, it's not going to help. Failure to complete prescriptions. So if you have a prescription, you're supposed to take it for 3 weeks. You take it for a few days, you feel better. So you just say, oh, I don't need the rest of the prescription. The bacteria can still be present. So you might feel better for a few days, but once you stop taking your prescription, it's just going to come back. So you always want to complete the whole time frame that you're prescribed. Purchasing through mail, that's something you should be cautious about with anything, especially medications. If you're purchasing medications or pills or anything offline, they may say you're getting one thing, but you might be getting something else. So that's something to look out for. Number 10, it's a few definitions. So neoplasia, oncology, carcinogenesis, and angiogenesis. So neoplasia is going to be the production of malignant tumors. Oncology is the study of neoplasia or cancer. Carcinogenesis is the development of a cancerous tumor. And angiogenesis is the growth of a blood vessel into tissue. Okay. Number 11, it says compare and contrast characteristics of benign tumors and malignant tumors. So with this, what really helped me study and remember these things, I kind of made a chart. So benign versus malignant, and then I had six different things. I'm pretty sure they were on the PowerPoint, kind of like a chart. So for benign, the appearance, they're small. They're similar to the host, sorry. So it won't look different from the tissue that it's growing in. It's going to look the same. The rate of growth is slow. Benign tumors grow very slow. They don't spread, so they remain local. The surface of these tumors are smooth and non-invasive, and the vascularity, there's little vascularity there. And the reoccurrence is rare. As compared to malignant tumors, the appearance is not like the host tissue, so these are going to stick out from where they're at. So if it's breast tissue, the malignant tumor that's there isn't going to look similar to the tissue that's there. They grow rapidly, very fast. They move outside of their original tissue. They don't stay put. The tumor surface is irregular and invasive. Vascularity is high vascularity. And the reoccurrence is readily. So they reoccur, they multiply, they move a lot more than benign tumors do. Number 12, it says discuss and explain warning signs of cancer. Any skin lesions that don't heal, a mole or a wart that changes size or shape. These are kind of things that we've all been told growing up, to keep an eye out for. If you have any abnormal cervix or rectum bleeding, bowel or bladder changes, or incontinence, persistent cough or voice changes, and then a lump within a tissue that you feel or notice that's not been there before that you haven't seen. 13, it says compare and contrast genetic abnormalities, chromosomal abnormalities, and developmental diseases. A genetic abnormality is going to be the defect on a single gene as compared to chromosomal abnormalities, which is going to affect the entire chromosome. So that'd be worse than the genetic abnormality. And the developmental disease is going to slow or impair motor development. The next one is a definition, and this is just a chemical agent that causes a birth defect. This is another definition that comes up a lot, so it's one to put in the back of your mind and store there, guys. 15, it says discuss PT precautions while treating a patient with hemophilia. So the people who have hemophilia, they're missing that clotting factor. It's not working properly. So precautions while treating them, axillary crutches. If people are leaning on those crutches all day with hemophilia, they have a high chance of putting too much pressure, and blood can pool in that area, or they can burst a vessel in that area. So that's very dangerous for them. Or high impact exercise. So with high impact exercise, you're moving a lot more, you're jumping, so you're more prone to falls. So if you fall, then you can burst a vessel, bruise, or injure, and then you have that blood pooling again, since these people don't have that clotting factor to stop the blood, to clot the blood. Number 16, it says describe the cell type found in the anterior horn of the spinal cord and what happens when those cells get injured, and relate this to spinal muscular atrophy. So spinal muscular atrophy was the progressive degeneration of anterior horn cells. So that's where this question goes together with the anterior horn cells. The anterior horn contains motor cells. So with spinal muscular atrophy, if those cells are degenerating in the horn, it's going to take away your physical strength. You're going to see a decrease in motor development and the motor skills in these people. So they're going to have a hard time eating, walking, standing, anything that takes strength, which is almost everything. Okay, so I'm going to go back up and go through some of the key points for the pathologies. The first one was bronchial asthma. The etiology from this is kind of simple. It's just caused by the allergic reaction. So this is what causes the asthma. Most of these patients are sensitive to a lot of things, but the biggest things are the change in temperature and humidity. That's something that really sets off bronchial asthma. The prognosis, depending on the person's sensitivity or their asthma, severe cases can result in death. But usually asthma can be controlled with meds, usually the inhaled corticosteroids that people take. PT interventions, we do breathing exercises, just a general exercise program, relaxation when they're having anxiety, or relaxation when they're having their attacks. Those are kind of the big things with bronchial asthma. That's something that a lot of people are familiar with, so it's not too hard. Down syndrome is the next one. This occurs because the trisomy of chromosome 21. Signs and symptoms are something that are very important with Down syndrome to remember. So pick a few signs and symptoms that are like bigger ones, stand out from the other pathologies that are in this unit. So what I did, I made a list and then I made flashcards of each pathology. And when I made my list, I compared things that were the same and things that are different. So my flashcards, the very bold top signs and symptoms, were the ones that are different, things that are going to make it stand out from the other pathologies. Like if you have a question on the test, they're not going to put a sign and symptom that can be multiple answers. So you want to find the ones that are different, that are going to help you identify this pathology and single it out. So with Down syndrome, they have varying degrees of mental retardation. A flattened facial characteristics is a huge thing that helps this stick out. The simian crease on the palm. So if you look at your palm, a lot of people have multiple creases, but the simian crease is just a single palm line. Developmental dysplasia of the hips is another sign and symptom that's big with this. Subluxation of the atlantoaxial joint. Hypotonia, so that's going to be a decreased tone. For PT with patients with Down syndrome, you're treating the signs and symptoms. So you're doing exercises to treat the hypotonia in the muscles. You're doing exercises to help strengthen the hip for the hip dysplasia or for the instability of that axial joint. You're doing strengthening exercises there as well. The next one is cerebral palsy. This is a central nervous system injury. It's a traction injury. So if you're pulling on an arm of a child, this happens a lot during births where it's a breached birth. Where is it at? The breech birth, or if they have to like remove the baby if things aren't going well and they pull on the baby, and the brachial plexus is pulled. I'm lying, guys. That's Erb's palsy. I'm sorry. So cerebral palsy. I'll just go a minute. It's the CNS injury from congenital abnormalities. There's 4 types. There's spastic, athetoid, ataxic, and mixed. So the mixed one can be a mix of any of those previous 3. This is damage to the infant's brain before, during, or after birth. Signs and symptoms. It's not a progressive pathology. Some of the pathologies are progressive, some of them aren't. So that means this one's not going to get worse. Mostly with this one, a big sign and symptoms, it's developmental delays. So in children, if they're not developing according to the correct time when they should be doing things, if they should be walking or standing or being able to feed themselves or hold their head up, and they're months and months behind. The signs and symptoms of cerebral palsy change depending which type you have. So there's a bunch of the 3 types, and then they can be unilateral, bilateral, hemiplegic, diplegic, quadriplegic. So it just depends. The signs and symptoms depends on which type. A lot of them will have hypertonia, or even hypotonia. Some mental retardation, vision, speech, and hearing deficits. There's no cure for cerebral palsy, but the biggest thing we work with are the physical disabilities. So PT, we teach using walkers or crutches or any assistive devices to help these people function more normally. Sometimes OT and speech therapy come in as well, depending on what disabilities they have. So if things with their right arm, or if they're having problems swallowing, speaking, and speech therapy comes in. Medical intervention, there's not much medical intervention except when they're diagnosing. It's diagnosed with a CT or an MRI of the brain. Okay, so Erb's palsy, the traction pathology, is due from breech births, a high birth weight, or a forceps. It says a forceps or vacuum suction when they have to like pull the baby out. So weakness or paralysis of the upper extremities comes. This is what this is. It comes from the traction injury. So with the Erb's palsy patients, PT on soft tissue techniques, E-stem, aquatic therapy, a lot of splinting, range of motion exercises. Medical intervention surgery could be done if it's necessary to do a nerve graft or a nerve transfer from the traction injury. And make sure you guys know the traction injury to the brachial plexus. The brachial plexus is C5 through T1. That's something else that is going to come up again and again and again. So make sure you know the brachial plexus levels. Scoliosis is the next one. This is a lateral lateral curvature of the spine. In high school, a lot of high schools do the test for this, so a lot of you are familiar with this. And symptoms, you can have one shoulder that's higher than the other from the curvature. The waistline's asymmetrical. Rotation often occurs due to the curvature of the spine. The primary curve that you'll see, the lateral curve, and there can also be a compensatory curve as well. If the curve is severe enough, it can also interfere with breathing. So the prognosis with this, it just depends on the curve. So if you have one of those severe curves and then breathing issues occur, it's obviously going to be a bigger problem than the rest. So you'll hear me sniffle a lot during this video. Medical intervention comes into play. If it's greater than 20 degrees, these people may be wearing a brace. If it's 40 to 45 degrees, then this is when surgery. They may have surgery to help correct the curvature. The PT intervention, we do a lot of stretching, strengthening, breathing techniques for the people who are having breathing issues due to the scoliosis. A lot of postural control comes into play with these people as well. And the PT interventions for scoliosis help kind of halt the progression of the curvature. So we're not saying that PT is going to, recorrect your spine alignment, but it's going to halt it from getting any worse, and it's going to help you learn better postures, breathing techniques, and those kind of things. Alrighty, the next one is spina bifida. Alrighty, so spina bifida, the etiology is unknown. So this is one, if I remember correctly, there's one other one that has an unknown etiology. They think it can be a combination of genetics or the environment, but no one's 100% sure. There's different types, the levels of spina bifida. So the signs and symptoms are going to depend on which level you're at. So the spina bifida occulta, there's not really signs and symptoms. A lot of people don't even know that they have this until, for some reason, they have a radiograph done for some other reason, and then it's found. The meningococcal, there's minimal damage to the spinal cord, so there's very few signs and symptoms. The most severe, which is the myelomeningococcal, you're going to have paralysis below the level of the lesion, bowel and bladder dysfunction. Seizures are also possible, learning disabilities, or hypotonia. So the myelomeningococcal is definitely the ones that you see the more signs and symptoms with because it's more severe. There's no cure, and the prognosis also depends on the extent of the damage, so depending on which level it's on, and when they catch it. Medical intervention, it says they can do tests during pregnancy to be determined, and I've even heard that nowadays if they test for it and they find it, they can go in and kind of fix things while the baby's still in the womb. PT interventions for this, we work with these patients on using assistive devices, wheelchair fittings, and they're using wheelchairs, positioning in wheelchairs and bed and everything. And if these patients have a shunt to drain fluid from their head, you have to be cautious during therapy that you don't mess with the shunt. One more. Oh, muscular dystrophy is the last one. Okay, so there's two types of muscular dystrophy. This is something else you want to remember. This question comes up a lot, the two types of muscular dystrophy. So you've got Duchenne's and Beckner's. It's an X-linked recessive chromosomal trait, so it affects mostly males and very rarely females. It's from the dysfunction in the gene that produces dystrophin, which is a protein that makes the muscle function. Signs and symptoms, it's progressive muscle atrophy. So if these people aren't doing anything to help slow that, it's going to get worse. If you don't use it, you lose it. So the atrophy starts in the lower extremities and goes through the trunk and then to the upper extremities is usually how that progresses in muscular dystrophy patients. So these children have a hard time moving around, walking, and they often lose their balance. And once the muscular dystrophy progresses so far, most of these patients are the ones you're going to see in the power wheelchairs. So with these patients, PT, we work on breathing exercises, balance, strengthening, positioning in the wheelchair again. Teaching them lifting transfer techniques from their wheelchair, and if they're not in a wheelchair, lifting and transfer techniques that they can safely do since they have muscular dystrophy. Medical intervention. With these patients, they may also have scoliosis. So medical interventions for this would be the surgery for scoliosis. And it looks like there's a link on your PowerPoint. So if there's ever a link, guys, make sure you take the time to click the links. Don't just click through your PowerPoints and ignore the links, because they usually have a lot of great information. And it may be information that pops up on your test that wasn't directly stated on your PowerPoints. You go back and put those links. Chapter 3 should be up along with this one just later today, guys. I did have some technical difficulties, so that's why it took a little longer for chapter 2 to come out. If you do have any questions, make sure you go back through your PowerPoints, you do your learning objectives, and if you have any questions, reach out to Crystal, Michelle, or I. We'd be more than happy to help you guys. And good luck on your next quiz.